Can you imagine a world where all jobs are replaced by robots? In today's day and age, almost everything we do uses artificial intelligence and robots. From self-checkout lines at grocery stores to self-driving cars, the era of robots taking over is arriving a lot faster than we may think. This generation is able to use robots to avoid difficult and repetitive tasks. Who's to say we can't do the same with our professional careers? Who knows, maybe one day robots will take over all of our jobs. Just kidding, hopefully they will make our lives easier. Today we're exploring the future of robots in dentistry. Will they enhance the way dentists deal with patients? Will they cause dentists to lose their jobs? To answer these questions, let's travel back in time to understand what a robot truly is. The origin of robots dates back to over 3,000 years and has changed drastically throughout the decades. Today, a robot often has varying functions and can process different materials, tools, parts, and devices through specific pre-programming. They also have a set of intended tasks for the robot to complete with 6 levels of control, also known as autonomy. These levels can range from 0, meaning the robot has no control over the tasks performed and humans need to make decisions, all the way to 4 or 5, which means that the robot has full control over all the decision-making. In the context of dentistry, this means that the robot would no longer be an assistive medical device, but can also independently practice medicine. This does not exist due to ethical and legal issues, but robots are still present in the dental industry. Although extensive research has been done on robots assisting with medicine, not a lot of research has been done on robots in dentistry. Let's take a look at the timeline of monumental advancements of robots in dental care. In the 1980s, the National Aeronautics and Space Administration, also known as NASA, is making critical progress in developing robotic surgical assistants on battlefields and in space. In the 2000s, the first robot is approved to assist with surgery by acting as a camera to help surgeons get a view of the surgical area. In 2010, robotics are implemented in oral dental surgery, specifically to treat obstructive sleep apnea. This is a disorder that is diagnosed in individuals who stop breathing during sleep due to the relaxation of the throat muscles. In 2013, a micro-robot with 3D motion control was created to help remove any decaying or damaging portions of the teeth. With the 3D motion software and the accuracy of the tooth preparation, the average time was shortened by over 50% to only 17 minutes. In 2017, the Food and Drug Administration approved the use of robots to check the accuracy of dental implant surgeries, which makes the process of getting a tooth implant more efficient and safe. In 2022, researchers were able to reduce anterior tooth surgeries to around 20 minutes instead of hours, while also making the process more precise and enjoyable for the patient. There is a lot of extensive research being done on the use of dentistry today in 2024. Dentists have trouble navigating the position of implants, so having a robot can improve the stability and accuracy of the implant placement. This avoids any human error like fatigue and avoids poor working conditions. Millions of Canadians are missing teeth, but creating dentures for these patients is a tedious job. Robots use 3D technology to aid with balanced tooth arrangements and gain accurate measurements of the jaws of patients. Robots also help to visualize the mouth when undergoing procedures like root canals or fillings. Robots are also able to complete a lot of the tasks of dental hygienists, like removing plaque, brushing teeth, developing x-rays, and many more. After discussing all of the uses of robots in dentistry, let's talk about the benefits. The use of robots decreases recovery time, reduces the pain for patients due to their accuracy and efficiency, prevents dentists from making many incisions, and helps them access hard-to-reach areas with ease. The robots also reduce the high-pitched noises from current tools that can be difficult for staff and patients to tolerate and can cause fear or discomfort. Robots also help navigate complicated dental procedures with precision, which reduces human error like hand tremors and exhaustion. Specific robots have been programmed to have the exact location and directions when drilling into the teeth, which reduces pain and increases accuracy. The use of technology for robots in dental education allows students to practice procedures with patient simulation without direct patient interaction, which prepares them for real-world situations. Since robots can complete repetitive and tedious tasks with ease, dental hygienists and assistants can focus more on patient interaction. This improves both the physical and mental well-being of staff and increases patient satisfaction. With all these benefits, what could go wrong, right? Unfortunately, there are a lot of problems regarding robotics in dentistry. The cost of accessing robotic technology can be a problem for specific dental practices. Also, if a robot was to malfunction during a procedure, it could harm both the patient and the staff. There must also be laws and regulations in place to determine how much robots should be relied on and in what capacity they can interact with patients. While dentists are predicted to still have job security, researchers believe that dental assistants and hygienists are likely to be replaced in the next decades because robots can take over their tedious tasks. These staff cuts can benefit companies by saving money but may ultimately result in the loss of human interaction and effective patient care. So after discussing all of this, will robots take over all job industries? The short answer for now is no. There must be extensive research, clinical trials, and laws and regulations to determine what tasks patient-facing robots can safely conduct. However, the dental industry is evolving at a rapid pace. From previously using narcotics as anesthesia, having dangerously high radiation problems, and not needing gloves to operate, we are making tremendous progress in emphasizing safety and hygiene. The addition of robotics could improve the field of dentistry and provide patients with excellent care. These new and upcoming technologies can change the world, so stay curious and keep an eye out because the future holds incredible possibilities and can impact the trajectory of dentistry forever.